Good evening. I would like to begin tonight with a question. What do the following situations have in common? Mixing orange juice and toothpaste, mixing bleach and ammonia, throwing darts at an inflatable dartboard, running a cross-country race in stilettos, and trying to fix a public health care system with a public option. The answer? Undesirable results. As you've probably already assumed, it is our position that Indiana should not institute a public health care option. Quite simply, this is because it is not the right solution to a very real problem. It is important for us to emphasize that we do not come before you stubbornly clinging to some idea that all is well in the world of healthcare and insurance. It is not. Nor do we wish to present ourselves as unsympathetic to the highly emotional nature of these concerns. We do not ask, or even wish to ask, that you would compromise your sympathy for families and individuals who are stranded under the current system. What we do ask is that you would show a careful consideration for the plan our opponents propose, that you would acknowledge that the pricing system of our healthcare structure needs fixing. But when considering a solution, we must look ahead clearly and objectively, so that in our urgency to right wrongs, we do not create for ourselves more of a predicament than when we started. So while we will debate the public option tonight, we must not consider it the only remedy when there are others waiting to be explored. In the words of Abraham Maslow, if the only tool you have is a hammer, it is tempting to see every problem as a nail. Ladies and gentlemen, tonight our opponents hold a hammer in their hands. And while it is tempting to view with them this situation as a nail, we must look at the facts that clearly say it is not. A public option will not do the job without equal, if not greater, consequences. One only has to look to Massachusetts to realize this. For the benefit of those unfamiliar, Massachusetts is currently implementing a government healthcare system in which all residents are required to have insurance and incur penalties if they do not. The government addresses the needs of the poorer citizens by offering subsidies through a program called Mass Health. Mass Health is supplemented by another program called Commonwealth Care. Together, these public options cover all low to moderate incomes and people with no access to insurance through work. Now here's where Indiana needs to pay attention. Massachusetts did what it set out to do. Through these public options, it insured all but 2.5% of its residents. That's the lowest rate in the nation, and standing alone, that fact deserves enormous applause. But before you get ready to head out that door, I would like to remind you that Massachusetts' plan is far from a dream come true. In fact, as cliche as it is, Massachusetts is facing a financial nightmare that has left its citizens, businesses, and government strapped for cash. Massachusetts is experiencing what many speculated would be the pitfalls of a public option. While most of you, I am sure, are more familiar with the subject on a national level, I ask you to consider these objections again within the context of a state-funded and contained public option. First, public options, like Mass Health and Commonwealth Care, undercut private insurers and then pass the costs to citizens and healthcare providers. This is not simply a stop raising taxes cry, although that too has merit. Middle-class families escape the supposed government safety web. They make too much to qualify for the publicly funded subsidies or care, and they make too little to afford that care on their own. Now combine this with a raise in taxes by the state. Massachusetts recently increased its sales tax by 25%, largely to cover its healthcare program. And now we've left those families in a real mess. Remember, we've only shifted the demographics for the people hurting under our healthcare structure, and now these people have no choices. There are penalties for people who cannot buy insurance or do not buy insurance. The thought being that having everyone contribute will somehow stabilize costs, which is a key component to any financial stability of a public option. Clearly, that theory has failed as well. Just look at the pressure placed on healthcare providers and businesses. Aside from being a monetary disaster, here the public option actually begins to undermine the very goal it is trying to achieve. In 2009, 6 hospitals filed suit against Massachusetts for failure to reimburse them for the money spent on government-insured patients. Collectively, these hospitals are suing for more than $100 million in shortfalls. Nor are these the only hospitals involved in lawsuits. No, these are the hospitals that aren't refusing to take patients who are on a government-backed insurance plan, like many of the hospitals do. These are the hospitals in which at least 63% of the patients are on the funded policy by Massachusetts. Now, because Mass Health is largely an extension of its Medicaid program, it operates like them. Medicare and Medicaid, essentially our national public options, operate by paying only a percentage of what private insurers pay. For this reason, hospitals limit the number of Medicare patients they will see, just like hospitals in Massachusetts. Now, I want to stress that this is not an issue of greed, like many would believe. As the president of Boston Medical Center said, we'll be looking at losses of about $160 million. That's simply unsustainable going forward. Those cuts undermine the efforts to provide quality care that was denied to portions of the population in the first place. They equate to equipment cuts, to staff cuts. Now the care that was denied to some people is denied to everyone. Plus, doctors need to make a living. Why would a doctor stay in Indiana if they are losing money under the public option? Why wouldn't they go somewhere else? So we ask, what good is public insurance if it doesn't pay for enough for a doctor to afford to treat you, or if it compromises the quality of the care you will receive? So the effect of a public option on a state's citizens and businesses is not good, but the list does not stop there. When Massachusetts signed their health care plan into law in 2006, the administration seriously underestimated the cost of insurance subsidies as well as other parts of the plan. Now, I don't mean to sound sardonic, but underestimating costs seems to be a theme in government-run operations. Estimates for mass health and Commonwealth care ran at about $725 million annually when instituted. Projections in recent years estimate that that number will actually be $1.53 billion due to hugely increasing enrollment. The economic recession, which is taking away government income, is putting people into new brackets where they can qualify for this care. Businesses are finding it cheaper to put employees on the government-funded plan rather than paying for it themselves. So regardless of the fact, when you have more people on the plan, you have to pay for them. And as the government income decreases, the costs of that plan do not. Now these costs have led to negotiations for federal funding. Massachusetts sought reimbursement for about half of its funding in 2008. This simply proves that the plan is not self-sustainable, and now those costs are passed to the nation. Note that while the federal government was initially supportive of the plan, it is not under any obligation to make up for Massachusetts' pitfalls. With Medicare and Medicaid already facing huge coverage cuts, the government's support for the state is hardly reliable or reassuring, given that it cannot manage its own financial problems. Already we see that Massachusetts is being forced to scale back its ambitions. It has had to eliminate dental, hospice, and skilled nursing care for 30,000 legal immigrants, and it has raised sales taxes on an already financially strapped economy. Perhaps this is why Obama, when campaigning for a national public option, has not held a single event focused on the Massachusetts experiment. We're not asking you to focus on socialized healthcare or national healthcare, but merely pointing out the undeniable failure of Massachusetts financially. Indiana should take note. State public options are a proposal, but they come with dire consequences. So let's not pound a square peg into a round hole. Let's drop the hammer and pick a new tool.
Keeping in mind that no Indiana resident will be required to buy insurance, and that the state will, in fact, not be paying for this new insurance, but simply structuring it, because consumers will be paying for it, how is this Indiana plan not sustainable?
Thank you for your question. There are actually two answers that I would like to provide to you. The first is that paying for a public option is difficult. And essentially what you have proposed is putting a new business into the market to act as a competitor. Again, there are sort of implications that come off of that. Already Indiana has many private insurance companies that provide adequate competition within the state. But paying for a public option raises some interesting questions. If consumers are the only ones who are buying them, what sort of consumers are you drawing, since these are the people who can't afford the care on their own? Where is the state going to make up for these subsidies? And then, do you need to tax the other people who are paying for the insurance? Are you forcing them now to pay for two types of insurance, one for themselves and one for the people who are buying into a supposedly consumer-driven option? The truth is, it's their money. And consumers already can't pay for their insurance. Look at HIP, as you've already brought up. If HIP is overloaded, which is essentially the type of business that you are proposing, will not those problems simply continue?